I'm a fourth-year medical student, really excited about going back to RAM. I went when I was second year. The volunteering and experience is great, and I'm actually from Wise County, so giving back to the community there is actually really important to me. I was actually born and raised there and came to college here when I was 18, so it's actually been a big part of my life, and being able to go back and give back in a different way is really special.
Supervised residents, I see patients, I help with the management of the medical students that are there, do some teaching while we're there, and we see the patients as they come through and provide them with the best medical services and the screening services that are available there for the time that they're there. Many people that come to this clinic, this is the only direct hands-on medical care that they get all year.
I will be doing a patient education piece for the Red Team, which means I will be talking to patients about any type of medical need. It sounds like a lot of people will be coming with the initial diagnosis of diabetes, or potentially having known they've had diabetes for quite a while but not taking good care of it. So I'll be providing them basic education on how to better deal with their health status.
I took Audrey Snyder's RAM class in the spring, and it was definitely something that really sparked my interest. I had planned to do some Peace Corps work when I'm done, hopefully, but this seems kind of like a perfect segue into that, just to kind of test the waters and make sure it's something that I really want to go into later.
I actually had the opportunity to go to the RAM clinic in Grundy 2 years ago when I was a second year. And it was just an amazing opportunity for me. Up until that point, we really didn't have any clinical experience, so it was the first time that I had done a lot of things actually interacting with patients. So it was really nice. And then since then, I've wanted to go back. Grundy was the smaller clinic. We only saw about 300 patients over the 2-day period, but even still, it was very intense. But it was just very, very worthwhile to actually get in there and feel like you were helping someone and that you were a part of the team.
Well, as a registered nurse, I'm going to be working in the triage area, so I will be one of the first medical people to interact with the folks who come to RAM. So I'm going to do a brief interview and get their medical history, and then I'll check their blood pressure, their pulse, their blood glucose, and decide those who might need to be seen more urgently than others. I go because I love getting into the community, and the people of Southwest Virginia are really so wonderful and friendly, and it's a lot of hard work in hot sun usually, sometimes pouring down rain, but it's very gratifying, and I come home feeling exhausted but really wonderful, and I wish I could do it more often.